Good evening. My name is Ernst Winando. I'm in the mental health program here at Regis College, and my presentation is on case number one, which is the one with IV drug abuse. Let's go right into it. So this is the case of a 28-year-old female with opioid use and abuse disorders. She uses IV heroin. She has a diagnosis of PTSD and no other medical problems, or she's not taking any medication. She's currently single. She lives with several roommates. She has some legal problem with some jail time, sexually active with men and women, and no consistent pattern of use of protection. Symptomology that we are known about the case is shortness of breath, chest pain, flank pain, and fever. So the slide next to it is pretty interesting. This will let us know all the potential comorbidities or issues that we can get into, and it shows that IV drug use and abuse can potentially affect every single systems that we have. The pulmonary system with patient can have anywhere from pulmonary embolism, liver with hepatitis, cirrhosis, pancreas, and you name it, even the sexual function. Where patient can have infertility, miscarriages, or sexual dysfunctions. So I imagine a 28-year-old woman that's sexually active, so she may have some complication there too. And also, last but not least, the things that I want to mention is the cardiovascular system. As you can see, myocarditis, arrhythmias, endocarditis, these are things that can potentially occur in a IV drug use and abuse situation. Intravenous drug abuse is, as you can imagine, is a public health concerns. It says in the U.S., but it's pretty much everywhere in the world. This is a major concern that needs great awareness in agencies and our government around the world. Part of her diagnosis is PTSD, post-traumatic stress disorders. So what Patel and colleagues in 2017 in their study determined that people with drug abuse, PTSD is very common among those individuals. And the patient with a history of IV drug abuse, so we noted, Joel and colleagues noted that there's a high risk of infections, several infections that can occur, like HIV, endocarditis, and other opportunistic infections, which we will talk about. Oftentimes, heroin is used in the form of IV drugs, leading to repeated use of needles. Pretty much when people are using IV drugs and doing skin popping, so they oftentimes they don't do it on their own. So there's friends that gathers small crowds and the sharing of needles, which pretty much means that there's potential for bloodborne pathogen to be transferred from host to host. Joel also found that, and his colleagues, that Bacillus cereus, which is a microorganism, that they noted that is involved in several other infections like musculoskeletal, respiratory, central nervous system, and cardiovascular systems. It's been reported that this particular microorganism causes infection like cellulitis and endocarditis, which we talked about. And if you can look at the slides here, you can see from 1985 to 2003, you can see how drug abuse move along the years, right? and the percentage of cases that they found, the proportion of AIDS cases in adult and adolescent, and with drug abuse. This was a major impact that Martinez and colleagues and friends have determined. It says that injection drug abuse also places the user at risk of acquiring HIV and hepatitis B and C. You can see the proportion here. So about 14% of people who were abusing drugs, IV, were HIV positive, and 52% were determined to be hepatitis C positive. So endocarditis is associated with IV drug abuse, right, and use. So endocarditis has a right-sided predilection, with the tricuspid valve being involved in 60 to 70% of cases. That's pretty interesting facts. Symptoms that we were given: dyspnea, cough, and chest pain can be a sign of cardiac or pulmonary complication of endocarditis. So you would do a chest X-ray, right? Chest X-ray to show single, multiple, or segmented pulmonary infiltrates, which is a sign of septic emboli into the lungs. These can become cavitated or associated with pleural effusion or empyema. So very rarely you could see pneumothorax being at play. Abdominal pain and flank pain should also bring on some suspicion of a renal pathology. When infective endocarditis leads to renal infarct or acute glomerulonephritis, acute interstitial nephritis, renal abscess, or renal cortical necrosis, patient may have pyuria or hematuria. Okay, granted, we did not have pyuria or hematuria as symptoms, but the likelihood of it being occur is possible. Drug use and injection use drugs are important factors in the epidemiology of tuberculosis. Tuberculosis is a possibility here too for her, because one, she had some gel exposure, which is pretty common in patient in those settings, and also with possible HIV being at play. Drug use has been associated with higher prevalence of latent TB infection and the incidence of TB diseases. Okay, TB outbreaks among non-injecting drug users have also been attributed to sharing of drugs, equipment, and cramped conditions, poor ventilations. So, and she has this as risk factors. Though drug use was described as TB risk factors even before the HIV era, HIV-induced immunosuppression is the most important reason for a high TB increase among IV drug users. Most available evidence demonstrates that IV drug users are greater risk for TB infections and diseases related to other HIV-associated risk groups. So this is sometimes confounded by regional and ethnic factors. There's a high prevalence of TB co-infection is commonly reported among HIV-positive IV drug abusers, particularly in patients that were spent some time in prison. TB is the most common opportunistic infection in endemic areas. It is also seen among IV drug abusers, even in low prevalence areas. There's evidence that suggests that there's a link between opioid use and kidney diseases, right? Our patient here today had some flank pain. So opioid overdose can result in acute kidney injury due to dehydration, hypertension, rhabdomyolysis. The complex interaction within the body and neuroendocrine system in response to opioid that are described below. Okay, so the renin-angiotensin aldosterone system and the antidiuretic hormones could play a role in the symptomology. Opioid use may result in chronic kidney disease due to repeated episode of acute kidney injury, so which she is causing by doing IV drug use on a daily basis. So as differential diagnosis, endocarditis is really the first one that I can come up with. And as far as tests, I would do 3 sets of blood cultures. You can imagine EKG will be in there, chest X-ray. TEE will need to be in patient. She will need to be in patient for that. Okay. If she's medically stable, so antibiotics can wait for the blood cultures because you want to be specific with antibiotic treatments. If she's unstable, so we would just go ahead and again use IV drug use. I mean, it would cover her for Staph aureus, B hemolytic streptococci, and vancomycin probably. The next one is I wanted to say TB, but pneumonia seems quite likely here too. So I would treat for community-acquired pneumonia or HCAP. So there's a high suspicion for TB, but so she would need to be isolated. If she's HIV positive, there's a high suspicion of there too. So you would do ABGs, blood cultures, and prednisone, and also treat with Bactrim for the pneumonia too. The third one that I put there is kind of a combo. We know NFOC or acute glomerulonephritis. You would do CT with IV contrast, LDH, FST, and UA. So you would recommend anticoagulation therapy, surgery if an IR consult if possibly, endovascular therapy, and possibly surgery too. My original differential diagnosis that I had was HIV, infective endocarditis, and septic emboli. After reviewing the material and studying for this week and the exams, so I kept the endocarditis on top, and because of what we just talked about, and IV drug use and endocarditis being likely culprit here, pneumonia and the renal infarct or acute glomerulonephritis. I wanted to put HIV in there, but the symptomology was not specific enough to that one, so I kept it with the renal system here. These are my references, so I can't wait to read your comments and concerns. Have a good night. Thank you, guys.